Gout. It affects 1 in 40 people in the UK and it can be extremely painful. If you haven't heard of gout, well, not to worry. It's basically a type of arthritis which causes crystals to form inside and outside the joints, which can cause severe attacks of pain and swelling. The joints affected are usually the foot, knee, hand and wrist, and especially the big toe. Men are more commonly affected than women, and if you get it, it needs treatment with medication. So this week's video came to me after a patient asked me what they can do to reduce their likelihood of getting another gout attack in the future. So as always, please help spread this video, like, share, and tag a friend who'll find this information useful. Now let's begin. Tip number 1, reduce the amount of food that you eat which are rich in purines. And if that makes no sense, then here's some information to help. Purines are a type of protein, and our bodies break these down into something called uric acid, which is basically a waste product. And if your uric acid levels are high for prolonged periods, needle-like structures can begin to form inside and around joints, which can eventually lead to gout attacks. In fact, diets rich in purines cause a 5-fold increase in further gout attacks. So to see which foods are high and low in purines, and as well as eating healthy at the same time, there's a great little guide on it which I put the link in the description below, so definitely check it out at the end of this video. Tip number 2, sugar sweetened soft drinks high in fructose can cause a buildup of uric acid, so try your best to avoid them. In fact, a recent study showed that having 2 sugar sweetened soft drinks a day increased the risk of gout by a massive 85%. That's a pretty amazing stat, but the good news for all the soft drink lovers out there is that drinks labelled diet or containing artificial sweeteners were not found to increase the risk of gout. Tip number 3, vitamin C supplements. There's conflicting evidence on taking this and it protecting you from gout. Some studies show that it reduces the risk, and some studies show that it has no effect. But I do see patients who swear by it, so if you do want to take some, I'd recommend you speak to your pharmacist, nurse practitioner or GP about it, as you might be getting enough in your diet. Tip number 4, get to a healthy weight. Approximately 50% of gout sufferers are overweight, and a healthy weight can reduce uric acid levels and gout attacks. But avoid any type of crash dieting, as this can actually increase levels of uric acid and gout attacks. Instead, go for a combination of physical activity and healthy eating. Tip number 5, drinking alcohol raises uric acid levels, which can cause gout. So, try to cut down your alcohol consumption, and if you can, try and have 2 alcohol-free days per week to help prevent an attack. Remember, men and women are advised to drink no more than 14 units of alcohol per week. And I've also left a link in the description below which gives you more information about alcohol and measuring units. And lastly, tip number 6, make sure to drink plenty of water, about 2 litres a day, which is about 8 to 10 glasses. I also made a video all about water and hydration, so if you've got time, feel free to check it out. The link is in the description below. And that's it for this week's video. As always, please help spread the word, like, share and tag friends who'll find this information useful. Hey guys, thanks for watching. If you haven't already, hit that follow or subscribe button now to get more videos.